Hi, my name is Dr. Sophie and I'm going to talk to you today about breakouts on the body, acne on the body. Why do we get it and what can we do about it? So obviously when someone is suffering from spots or acne on the face, it can be far more visible, but a lot of people struggle with breakouts across their chest, their back, or even the top of their arms. And there are a few key things you can try, bearing in mind it's much harder to apply treatments yourself to your back than it is to do your face. So one thing I always do is a few basic dietary things. It's always worth thinking about your dairy intake, because we do know that high dairy diets are linked with acne. And also looking at your sugar intake, because sugar can contribute to spots. So it's not something to say go completely sugar free, but maybe thinking about trying to cut back can help. I'm a big believer in supplementation as well, and we know how important things like zinc are, but actually there's a brilliant supplement called the Pro Clear by Zenny, which contains zinc among other things, and is really effective at helping to control breakouts. And because you're taking it in supplement form, it will work on your back, your chest, your arms, as well as any spots on the face. Now, if you're looking at doing treatments at home, it can be quite helpful to have someone to give you a helping hand. So using a good salicylic acid based cleanser on the affected areas, whether that be with a sort of a soft body brush, or whether that's with someone else helping you to rub it in before you get into the shower, is a really good move. It's an area we often only really wash with water, and using the right cleansers and the right products can make a real difference. You could also just look at applying a salicylic acid based toner or gel to the area, because that can also, after you've got out of the shower, dried off, apply that. That would be another way of doing it, but you might need some help with that. And then apart from that, really trying to minimize the sort of sticky, claggy moisturisers you're putting on affected areas is really important. Some of these might be occlusive, might not let the skin breathe, and we want to make sure that we are using products that are friendly and don't trap bacteria against the skin. There's a brilliant product if you're someone who goes to the gym regularly, which you can use after you've showered and cleaned off, called Cliniset Plus, which will rebalance your microbiome and decrease the bacterial levels in your skin. So it's not instead of a shower, but once you've showered, that can really help to strip back some of the bacterial load on the skin. I'm a big believer in LED for acne as well, and it's an area of the body we can treat very effectively with LED. We tend to use blue light, and there are also some home use devices available which you can clip onto small affected areas, and it can be a really effective treatment, again, for decreasing the bacterial load and decreasing inflammation. Peels are my ultimate favourite though, be that as a standalone treatment or as part of a hydrofacial. Peels contain acids which will help to exfoliate healthily, clear and unblock any clogged pores, and just generally keep the skin cell turnover more effective, so that you can reduce breakouts. It's not something that's going to happen overnight, and it might need a little bit of a helping hand and a bit of patience, but you can get some great results.